Hi everyone, my name's Pieta Valentine. I've written 2 books, The Resident's Voice from a Dementia Unit and The Resident's Rise from a Dementia Unit. So the session today is on mobility and medication. I'll just qualify here that my background is physiotherapy, so we deal more with muscles and mobilizations, joint mobilizations for the neck and back, and mobility. We don't medicate and we're not trained in medication. So this video is about the side effects of medication in mobility that I've observed. So just to please, qualify that. Okay, so in terms of mobility in the walking unit, for those, generally the average age is between 83 and 85 for most people that come into a dementia facility. And probably of that age group, about 50 to 60% would be on walkers in terms of mobility. So, that's a large lot of people going around with walkers. Everyone having different strength and capacity and walking stride ability. But they've been diagnosed. They've been assessed and given a walker and in they come. Now with that though, in terms of mobility, it's good still to encourage mum's independent mobility as much as you can, because that's good for balance and strength and all the rest of it. So if your mother is in her own room where she knows where things are and it's only a short distance, say from the bed to the chair, and she walks around on her own, even if a little bit sort of not staggering, but not perfect balance, but she's confident, her gait's stable, her strides are good, and you can see that she's safe, then it's fine if she walks around her room without the walker. It's actually good, because the thing is, you can't actually improve your balance reactions unless you test them out and you use them, to be able to adjust, constantly adjust. So if she does that in her room, at least she's keeping some balance reactions going. Whereas on a walker, you're fixed, aren't you? You're stuck, you're stable, and you just walk along. You're not using your balance, you're just, using the walker for stability, that which it gives. Some people find it helpful, some people don't. If you've got Parkinson's, for example, and you've got poor balance and festinating gait, the walker will help a bit. But sometimes I think what is really helpful is if the person walks down if you're with your mother, for example, rather than using the walker, ask her to put her hand on the railing that goes all down the corridor, because that gives really good stability. You can take her hand the other side and just do some practice walking, exercises up and down the hall with her holding on to one side with the railing and you holding the other hand for a few times, and then again her doing it on her own, just holding on to the railing, and you letting her do a few lengths without your support, because that way she's got support, she's got stability, she's safe, but she's using some balance reactions as well, and she's getting some respite from having to use the walker, which can be quite difficult. You can get sore shoulders from pressing down and a sore neck, from straining it as you're, trying to look ahead as you're wheeling it along. It's good to be able to stand up straight, walk and stride out, which they can do if they have that support with the rail in the corridor. And often residents' room is, up to 30 metres away from the lounge. It's quite a long way compared to, in their normal home. You wouldn't generally walk more than 5 metres to get to the bathroom. So, 30 metres is quite a big difference to 5 metres, and then back again, that's 60 metres. And then if they lose their way and they get confused and they keep going round and round the facility trying to find their room, it can be hundreds of metres that they're walking, which that is really stressful. So actually I've done videos on helping with direction orientation because of that very reason, which you can look back at if you're interested and need to do that to help your parent. Okay, so mobility and medication. Now, if you find when your mother say your parent mother, comes into the facility and they're independent, they're walking well, they have got the walker, but, you know, she's not needing to use it in the room. She can walk with you easily, just with you holding her hand, and of course going up and down the corridor, holding onto the rail. So all of that is good when she comes in, but you find very quickly her mobility goes down, you know, like sort of exponentially down, like in about 2-3 weeks. It just, yeah, becomes like a rapid decline, we may say. Now, and you have, you know, your mother's had dementia for 8 years. You've never seen, 8 years, you've never seen a rapid decline with her before in the trajectory, but all of a sudden into the unit, in 2-3 weeks, she's sort of festinating gait, stumbling along and unsure of herself, and the strides are short and her balance is gone, and, you know, it's a really big change. It could be, especially if your mother's been anxious when she comes in, often the case, and they've been medicated with something like haloperidol, then it could be the medication that's causing this Parkinson's symptoms, because some of these medications, including haloperidol, do cause Parkinson's symptoms. And yes, I know that people with dementia, also elderly age group, do get Parkinson's, but if your mother didn't have it before, and Parkinson's also is slow progressing, but if your mother didn't have it before, these Parkinson's symptoms, and then all of a sudden she's getting them, like a rapid onset, it could be the medication, and that's when it is important to assess this yourself and to bring it up at the doctor's meetings. And if the doctor's meeting, if you've already had a doctor's meeting and this, you know, you've read up about this and you've been thinking about it and observing your mother, wondering whether it's the medication, you can request a doctor's meeting earlier, you know, if you have concerns. So do that. Don't wait another 3 months for the next doctor's meeting. That's far too long to wait with your mother struggling, you know, with her walking. Have the meeting and ask if the medication can be reassessed, because you think that there's some effect with your mother's walking, and she was such a good walker before and never had any trouble, and very quickly now she's, you know, having great difficulty with her gait. Be informed before you go into the meeting, as the last 2 videos are on with doctors' meetings, and that's part of the whole medication mobility approach that helps a lot, because the more mobile and independent your mother is, the better quality of life. I mean, these people are often in the unit for 3-5 years, you know, it's a long time. So they need, you know, it's a lot of our life is 3-5 years, you know, so if you think about it. So that's why it's important to get everything set up, you know, the medication set up, the room set up, you know, the mobility organised, and in that way you can be, then you can, you know, it's not so time consuming once your mother's settled in and she's made a friend and her mobility's good and her medication's settled and everything hums along, ticks along. It won't be so time consuming for you to have to sort everything out, but it's better to do all this at the start of the time that your parent goes into the unit rather than later on, because, you know, if they've had medication levels affecting their balance and walking for, you know, 2, 3, 4, 6 months, then it's difficult to recover from. So that's why it's good to sort of nip it in the bud and get organised with this straight away. So that's the end of the session today on medication and mobility. You know, your mother may well have a walking stick as well. Some people have walking sticks in dementia units, but it's mainly walkers that you'll find, and make the walkers identifiable too, so that, you know, they're easily recognised by your mother and staff, and by your mother and staff, and that will reduce another stress as well. It's all about reducing the problems and coming up with the solutions. You know, yes, there's quite a few things to consider, hence so many videos, but we're getting there. Okay, so that's the end of today's session on medication and mobility. Thank you for viewing. Thank you for your likes. And for those of you that are viewing, please subscribe, just to be able to support this channel and to support these people, these residents in these facilities, so that they can have a voice and a say and a quality of life, through being helped with these various techniques. Thank you.